All right, so I think we'll start. Thank you so much for joining me. You're all here to learn about my new book, Transform Your Guilt and Shame. Yes? If not, you can stay and learn about it anyway. I'm so glad to have you here. I know there's a lot going on, and so a lot of options, and so I'm really grateful that you're here. And I don't have a formal presentation set up. I thought I would tell you a little bit where the impetus of the book came from, what the rationale, the sort of evidence is for the strategies, and really hope to have an interactive opportunity for you all to ask questions, to give feedback if you have read it, that kind of thing, and just your thoughts. Does that sound good? So way back when I was a wee baby postdoc at the VA, I had a great opportunity to learn a lot of great evidence-based treatments for PTSD. So I was trained in prolonged exposure. I was trained in cognitive processing therapy. And I also worked on this research project that was testing out Edward Kubaini's cognitive trauma therapy. At the time, it's called for battered women. Now it's for intimate partner violence. And they're all CBTs, right? Cognitive behavioral therapies. So we work on people's cognitions related to the trauma. That's not helping them now. It might have been helping them survive the trauma. Not so helpful now in terms of having the kind of value-based life they wanted to have. And then working with behaviorally, with exposure and like stopping all the avoidance that we know, right? Continues PTSD, post-traumatic stress in all its forms. Hi, Nick. And so the what we were finding, myself and my colleagues, was that these great treatments were treating PTSD. They were doing it effectively for most of the veterans at the time I was working at the VA, we were seeing. But there was sometimes like something that would hold people back. We would kind of stall out, or people could start and then they would just disappear, right? And you all probably have experienced this if you've done any treatment. But we're starting to notice this pattern, especially after we got trained in cognitive trauma therapy, Kubaini's model. It has this guilt module in there because that's a big piece of post-traumatic distress for domestic violence survivors. Should have left sooner. I should have known. I should have protected my children. Shoulda, coulda, woulda, lots, right? Which we were hearing this with the other kinds of trauma we were working with. And so because we got trained in that, hi guys, we started noticing in these veterans with combat trauma, military sexual trauma, all sorts of accident, trauma, natural disaster, that there was a guilt piece there that was pretty important, pretty critical. And if we didn't ask about it, people didn't tend to tell us, because there's a lot of shame that comes with guilt. If I feel like I did something wrong, I could have prevented this horrible thing from happening, or I could have done something to make it better, quicker, feel really a lot of shame. And it turns out trauma-related guilt shame is always present. And so people, this is an interpersonal emotion. We tend to hide that from people, right? So we're going to do this little experiment, if you're willing, where you think about something that you feel shame about. Now, it doesn't have to be trauma related. It can be just something that's, still just kind of bubbles up some shame. All right, now look to somebody next to you, behind you, in front of you, in the eye. Think about this thing that you're ashamed of, right? How easy is it to look somebody in the eye when you're thinking of this shameful thing, right? Like the thing you want to do is look down. Okay, you can stop. Thank you. You all did amazing, by the way. But it's tough, right? Like the thing you want to do when you're ashamed is look away, hide. I don't want anybody to know me. Is the volume okay, by the way? I keep feeling like it's too loud if I'm up here. A little closer? Okay, because I know there's a lot of buzz. So this happens in the clinical room too. People don't talk about it. So we started, because we had been trained in this model, we started asking about it. Is this what's stalling the therapy? Or we started listening for it. And we actually kept seeing it over and over and over again. And then we started applying these strategies that we learned from Kuwaiti's technique. And we started seeing more people shift a little bit, being willing to stick it out, talk about it. Because the more you sort of open the door to these very shameful, embarrassing things, and we would talk about it like, this is a normal occurrence when you've experienced a trauma. You're gonna feel guilt and shame. And part of the reason for that is that it's adaptive for us to question, is there something I might have done differently or I could do differently next time? That's very adaptive, right? It might help us next time. Okay, well, I did this. That didn't work out very well. Maybe next time I'll do this. And then we can let go of the guilt and the shame, right? We learn from it. It's adaptive. Well, what happens is if we don't do that, we get stuck with the guilt and shame. Just like anything else we avoid, we just get more and more and more of it. Even though we might be really good at avoiding, it comes out in other ways, right? We all know this. So we started applying these strategies. People started moving. So then we thought, you know what? We need to kind of write up this model to test it out with these different kinds of trauma, because maybe it's just us. Like maybe we're just really good therapists and this is like working, or we're biased and we think this is working, but it's something else going on, right? We all know this as scientists. We need to test this out more empirically. So we wrote up a model, the treatment manual for TRIGGER, which is trauma-informed guilt reduction therapy. We tested it out. First, we piloted it. Then we did a 2-site trial, randomized clinical trial, and turned out we got some really good outcomes. It's a 4 to 6 week session treatment, by the way, and just really focused on the guilt and shame, and then re-engaging with your life in a valued way. And we had some really good outcomes. And so this is the self-help version of TRIGGER. So that's the evidence base behind it, why I felt confident sort of sharing it and making it available to people who can't access therapy, who don't want to access therapy, who have tried to access therapy, but maybe their therapist is not doesn't have trauma expertise, doesn't really know about how guilt and shame is involved in trauma reactions. And so that's the sort of foundation, that's the background information. The strategies are not new to anybody who's done cognitive behavioral therapy. You're challenging people's thoughts, ideas about what makes them feel guilty, what makes them feel ashamed. Your job is not to convince people when you're doing TRIGGER. And the book is not trying to convince people. It's more about just learning about this association between trauma experiences and guilt and shame, how often the thoughts that promote guilt and shame are not accurate, ways to challenge them in different ways. You know, as we know, sometimes these thoughts that we have, they're not helpful, get stuck. And so we chip away at them from different directions. So these are just really helpful strategies. They're not meant to replace evidence-based treatment for PTSD. I found it really helpful, and my colleagues and other people have found it really helpful to do it as an adjunctive, sort of. When you're doing PTSD treatment, you get stuck, or and if you become aware that guilt and shame is a big piece of it, you're gonna assess for it right from the get-go. And so you can target this in these different ways. So I'm just gonna leave it there and see if we have any questions so far, any comments, anybody's read the book or has done TRIGGER or has maybe worked with PTSD and has worked with folks who have really well-entrenched guilt and shame, have had difficulties. Any questions, thoughts, comments? Yes? The question is, why is there a red front? Okay, it's origami, so it's basically transforming something that's really problematic. We had initially thought about like a crumpled piece of paper turning into the swan, but we just thought we liked the end result, So you can find peace if you transform your guilt and shame, and it's not about getting rid of guilt and shame, because like I said, it's adaptive, right? It keeps us socially connected. There's social emotions. I want you to feel guilty if you did something to hurt me, right? I want you to feel ashamed for a moment so that you can decide to act in a way that's going to be more socially acceptable, right? And so that we can maintain a relationship. So it's not about getting rid of guilt and shame. It's about transforming it so that it becomes adaptive again. It's supposed to maladaptive. Yes.
Can these strategies extend to elements where guilt and shame stem from individuals in your life who use guilt and shame to control your behavior or impact you, whether that comes from culture, familial expectations, unhealthy relationship dynamics?
Yes. Okay, so the question, if I can summarize, can you use the strategies in here to address guilt and shame that's kind of imposed by folks in your life, family members, maybe your community, the cultural beliefs and values that maybe, right? Yes. So it is a lot of the examples and work and illustrations and strategies in here are absolutely trauma focused, in that they deal with cognitions and strategies to address those cognitions that are really, really common when you've experienced a trauma. But if you read the book, and you have, so maybe you can attest to this, you'll see that like we have these guilt and shame cognitions about anything and everything. Like the exercise we just did, I asked you think about something that brings some shame for you, some shame feelings. And I asked you not to think about something traumatic necessarily. So you probably came up with some, right? Like, I kind of did this thing to this person or something like that, right? So absolutely, the strategies are applicable to all sorts of cognitions that bring guilt and shame, because what you get to do is learn. You're not avoiding it. You're going to try and learn from the guilt and shame thoughts that you have, or the events and the thoughts that cause the guilt and shame, but then kind of correct any inaccuracies. And when it comes to other people imposing, often it's inaccurate. Like just like we can be inaccurate in our thinking, certainly they can be too. So you don't have to buy it. Does that answer the question? Good question. Yeah. Yes.
I'm curious if you can talk more about the awareness that came from how we don't look at somebody in the eye when we're focused on our own shame, and just how would you use that knowledge?
So do you mean how did I become aware of the sort of shame stance we take, or how do I use that in the clinical room? Can you rephrase your question?
Yeah. So I'd say definitely one thing is, like, what does it mean in other contexts if you're taking that stance? So is part of the healing process also teaching yourself to maintain a certain stance? Did it give you any other wisdom or information about, okay, they're not looking at somebody? Well, what does it mean that you're not looking at somebody? So what other things does it tell you about yourself?
I definitely bring it up in the clinical room if I see it. But I also give psychoeducation about it, in learning about guilt and shame and the adaptive nature of guilt and shame. And shame, people think like, okay, guilt I get, like it'll stop me from doing something, maybe that'll hurt somebody's feelings. But shame, like what's the adaptive nature of that? Well, there's some examples in the book. And one of them is when you're experiencing a betrayal trauma. Is everybody familiar with betrayal trauma? It's like when somebody close to you, somebody you're dependent on, is perpetrating abuse against you, right? That's like considered a high betrayal trauma. And it tends to be more deleterious than other forms of trauma. And one of the reasons we think is because you have to maintain attachment to this person, usually a caregiver or somebody maybe that you're dependent on, like in the military, like a supervisor or something like that, right? you have to maintain attachment. So that means you have to turn off your normal cheater detection, betrayal detection, adaptive system in order to maintain attachment. And so we know when we have to turn off a part of ourselves, that causes a lot of distress, right? And problems, mental health problems. So in that scenario, coming back to your question, when somebody perpetrates abuse against us, but we have to maintain attachment, it's really adaptive to take that shame stance. Look down, hunch your shoulders, disappear into the background, because that's more likely to help sort of dissipate the abuse, to make the person less angry at you, feel like they've controlled you so they can stop sort of amping things up. It's sort of like the freeze response, right? Taking that shame, one down approach, it makes it more likely for the abuse to at least not get worse. So it's very adaptive. The problem is we carry that forward in our life and we carry that shame with us if we're not aware that that's where it came from. So a big piece of Trigger and in the self-help book, Transform Your Guilt and Shame, is learning about this, where it came from, so that you can kind of detach from it. It's not me, it's like what I had to do. Does that make sense?
Yeah. So now I'm curious if in some ways the guilt and the shame are opposite each other, in the sense that, all right, I sort of shut down to stay within this attachment, but the other option is I make it known to this person what they're doing that would feel good for me, and then they feel, sort of putting guilt on them.
Yeah, but if you're in a situation of being dependent on the other person, that wouldn't be in your best interest to put it on them.
To let them know what's off.
Right, because you need to maintain attachment to survive. It's all about survival, it's not about feeling good.
Okay.
So
does that mean that when people don't need to maintain the attachment, they're more likely to address it and let the other person know and sort of take
more likely, but there are all sorts of different scenarios that make it also adaptive for you to still take it on. So you might not be dependent on somebody, but if they have more power than you. So in the example of sexual abuse, you might not know the other person, you might not be dependent on them, but if they're bigger and stronger, you're still going to not confront in the same way as if you're talking to an equal.
And I'm curious also if you could talk more about, I love the example you gave, like, I want you to feel guilt, if you did something, that hurt me, so that we can then progress and transform from there. And I'm curious if you can talk more about that person's reaction to, in a sense, guilt being put on them, and the different choices they make from there.
So the question is, can you talk about the other person's reaction if you do confront them when with something that they've done to hurt you? This book and Trigger is not about that. It's really about what you can do, what's within your control. And in fact, we talk about working on what you're doing that's helpful for you, that's not helpful for you, so that you are better able then to address things externally, right? So you can kind of you can tell the difference between, am I doing something that is hurtful to somebody, or is this like sort of baggage that I brought with me? And then you are more living according to your values, and you're going to make value-based choices as opposed to avoidance-based choices or guilt and shame-based choices. And that the outcome of those actions are not really in your control when you're dealing with somebody else. And so what working with these strategies helps you do is that, though, not continue to take on somebody else's imposed guilt and shame, right? And you can kind of do that work ahead of time too. Kind of, okay, you might have some expectation of what somebody else might be telling you or, responding to you in a way. And you can kind of do that challenging ahead of time to prepare you. So that's what this book is about. Other thoughts, reactions, questions?
This is great.
Thank you. I'm going to come over here because I can't hear over there.
When helping clients work through this self-help workbook, is there a pace that you kind of guide them in working through it, or do you kind of let them like set the
Okay, so the question is about pace. When people are working through this, whether you're helping them work through it or you're recommending, I'll tell you how fast trigger goes, and this is based on trigger. 4 to 6 weeks for like a 90-minute session per week. So it's fast. And the guilt, the cognitive work, the guilt challenging strategies, we do in 1 session, sometimes 2. And then you have them practice it, so when they're working through the book, they could go at that pace. And really the idea is just like any other cognitive behavioral therapy, you're doing homework, right? Like you're doing the practice. That's the crux of the therapy. All right, so we have 2 minutes. So does that answer your question? Okay, perfect. So the bottom line is like they can go at whatever pace they want, but the faster they go through it, as long as they're doing it, the faster they get better, right? It's like pulling a Band-Aid. Like, don't wait, just do it, right? So we have 2 minutes. Any other final thoughts, questions? Yes.
Version from collective culture versus individualistic cultures.
Oh, cultural question. Thank you. Yes, there are differences. And there's a section in here about one of the contexts, culturally based in terms of guilt and shame and how that plays. And yes, and it does kind of, okay, so every culture that's been studied so far, guilt and shame is present with trauma, right? And this has been like internationally, lots of non-Western countries, different like ethnicities within same countries. And so it's present in every culture. It may manifest slightly differently, just like everything else does. Post-traumatic reaction might manifest differently in different cultures, right? And so the thoughts, the cognitions we have might be different, but just like any CBT, the good news is that's what we work with, right? I give examples of like what your thoughts might look like, but really we're working with your thoughts. What are you telling yourself? So absolutely culturally relevant in terms of like what's coming up for you, and we address that. Yeah. So thank you very much. We are out of time. Really appreciate you being here.